Hi, I'm Alice Lee, your holistic psychiatrist, back again to do a short video on another topic. And today's topic that I want to talk about is called how integrating three fields of medicine is more powerful in its healing approach than just any one field alone. The three fields of medicine that I work with integratively are allopathic psychiatry, functional or orthomolecular medicine, and energy medicine. And let me just describe what each of them are and then how they are more powerful together than alone. So allopathic psychiatry is really the use of prescription medications mostly to help treat symptoms. It's a very straightforward field, whether it's depression or bipolar disorder or anxiety or psychosis. So it kind of boils down to symptoms and their treatment through medication. In functional medicine or orthomolecular medicine, it's a little bit more complex because its basis is on the study of the basic biochemical functions of the body and how to support the body's innate biochemistry to function better. And so a doctor has to understand how symptoms might be a reflection of underlying biochemical causes. An orthomolecular or functional medicine doctor is going to do functional testing, lab work, to try to ferret out underlying causes and try to treat those causes through natural approaches, whether it's nutritional support or detoxification or the treatment of viral or fungal infections, for example. In energy medicine, which is more of an Eastern approach, the doctor who's interested in focusing on that field is interested in the mind-body connection and how energy flows. There's a very different kind of a quantum physics understanding of the body, and there are many different approaches, whether it's through Tai Chi, acupuncture, acupressure, meditation. There are many, many different forms of interventions that can be used by a person in energy medicine to help heal a person from their health problem. So all of these different fields can be learned and at least somewhat mastered. I would say at least explored to the extent that you feel comfortable using at least some of the techniques. You can't ever be fully, a master of every tool in energy medicine or every intervention in functional medicine, but you can start to educate yourself enough that you can start to integrate them together into one cohesive whole. And that's what I've tried to do since 2002, to integrate both functional medicine and energy medicine into my practice along with allopathic psychiatry. I wanted to divide my presentation to content, process, the outcomes, and maybe a story about how the outcomes can be different. So let's talk about how these different fields have different contents and how integrating them makes it different. The content or the tools in allopathic psychiatry are prescription medications. The content in functional medicine or orthomolecular medicine is, let's say, nutritional supplements. And the content in energy medicine are energy medicine techniques. Each of them are different, but they're not mutually exclusive. You can start integrating them together so that you can treat the individual as a whole, both through mind-body techniques, healing their body so that their body can have an innate ability to heal, and you can even integrate medication management in there so that when the person is no longer in need of that dosage of medication, they can start to withdraw from it. When you integrate all three fields together, you have the opportunity to help someone not only stabilize, but also be able to resolve their mental illness and no longer have to be a patient. I've seen that repeatedly in my practice, whereas with other fields, sometimes it's not quite as simple as that. The process is different. In the field of psychiatry, allopathic medicine, the process is where you would go in to see a doctor, get an interview, they would assess the symptoms and match those symptoms with a medication. The process in functional medicine is where you go in, see a doctor, they will take a look at your symptoms, try to heal the underlying causes through functional lab work or other testing methods, and treat the underlying causes through their tools, their supplements or detoxification or treatment of infections. And the process that is done in energy medicine is the intervention of certain techniques that help with unblocking energy, allowing energy to flow properly, such as in acupuncture or many of the energy medicine techniques in psychotherapy do the same thing. In terms of outcome, the outcome in allopathic psychiatry generally is that a person will be stabilized, hopefully, without too many side effects from the medications, hopefully, and in general be maintained on that medication. So they become a patient for an unspoken number of years. The doctor never clearly states when they can come off, but when most doctors, when they've put a patient on a medication for many years, it's very difficult for that patient to come off that medication without some withdrawal side effects. The outcome in functional medicine tends to be more positive in that if you treat the underlying causes, a lot of times the symptoms will resolve on their own, and a patient will walk away with a lot of understanding about nutrition in terms of interventions, and they can actually resolve their disorder without having to be a patient for the rest of their lives. The outcome in energy medicine can also be the same, that patients can come in with a lot of problems. They can use energy medicine as a healing modality and resolve their underlying problems and move on with their lives without having to be a patient for the rest of their lives. So when you integrate all three fields, the outcomes are much more profound, dramatic, and positive. So I've seen a lot of patients that normally would have been on medication for life if I were to treat them as an allopathic psychiatrist, who are able to function quite well without needing to be a patient. They can resolve their issues and be able to move on with their lives, being very successful at their profession. I'll just maybe finish up with a little story about a young adult. I'll call her Anne, and she's in her 20s. She came in because she had severe anxiety. Her psychiatrist put her on a second antidepressant to treat her anxiety, and it caused catastrophic reactions. She started having severe panic attacks. Her hair was starting to fall out. She was so anxious she couldn't get on the plane. She had to be put on a wheelchair and go on the plane that way because she was having such severe panic attacks, and she had to drop out of college. She had finished 1 year of college, and towards the end she was barely hanging on. So she came to see me because she was no longer able to continue her life. She had to go back and live with her parents. She couldn't continue college, and we were working together with both energy medicine, functional medicine, and the allopathic psychiatry approach to try to help her to stabilize and get better. With Anne, what we did was she was started on a nutritional supplement regimen. She was taught how to do energy medicine techniques, and over time she was able to heal enough so that her medications can come down. Both of her antidepressants were able to gradually come down. She then was able to resolve her symptoms, like completely resolve her anxiety. She started college in her nearby community college. She did very successfully there, and then she moved on back to her college that she had left in another state. She was able to travel and fly without anxiety, and at this point she's continuing with her college education on a few supplements, and now of course she knows some energy medicine tools that can help her mitigate anxiety if she has additional stress. So for Anne, what she was able to learn was so valuable to her. She was able to learn that you can heal from mental illness using supplements, using energy medicine techniques, come off these medications, that she changed her professional goals, that she wanted to become a holistic psychiatrist herself. And she's doing very well. She's getting good grades, and she wants to become a physician. Another story is about a young man. He had been sick most of his life, had been on medication since about age 7. He was also smoking marijuana several times a day. Let's call him Jason. So Jason came in, and he was addicted to pot. He was on an antidepressant. He was on a stimulant. He just was underperforming. He wasn't doing well at work. So again, we intervened with some energy medicine techniques. His attention span was very poor, so I created a positive affirmation that he can use for medication withdrawal that was just one sentence long. It was less than a minute. He would listen to that in his truck going to work every day. And that was his meditation. And he also took his supplements regularly. And then in time, he was able to lower his medications. He stopped smoking pot. And during this period of healing, he became assistant manager at his work. He then applied for college. He went back to college. He couldn't finish college before, and so he had dropped out of college for a while. So now this young man was able to apply for college. He went to college and was getting straight A's, and he's moved on with his life, so I don't have to see him anymore. These are the kinds of stories that I want for young people. When you're young, you're in your 20s, and you have anxiety or depression, or you're stuck, with a dependency on alcohol or marijuana or whatever it is, sometimes it may feel like there's no answers. You may not want to be on a medication, but you're stuck on a medication for years and years, and you just think that there's no other way to heal. And I just wanted to do this presentation to show you that at least in a practice where there's an integrative approach, where the doctor has many more tools to work with, people who are open to these approaches do have the opportunity to heal from their disorder, even though it may seem very difficult to heal from them, and that I've seen it happen repeatedly. I would encourage people looking for help, mental health support, to look for doctors who have those tools and are comfortable using them and integrating them in their practice. So good luck to all of you out there who listen to this and now know that it's possible to heal from mental illness, to resolve it, and no longer be a patient. Thanks for listening.